All right, where are my LTC nurses at again? Come on in. All right, now that you're in, I want you to go ahead and pause this video, and I want you to go look up stasis dermatitis. Okay, now that you're back, right? You've looked up stasis dermatitis, you looked up pictures, you looked up definitions, you familiarize yourself with it, and you're like, oh yeah, I've seen this in some of my chronically ill patients. So I wanted to talk about it because I've noticed it's a common thing that some people mistaken for cellulitis, right? And so when someone has stasis dermatitis, they have, you know, poor circulation. The valves in their veins don't work properly to bring the fluid back up, right? So this is a common disease that we can see in those who might have heart failure, renal disease, obesity, chronic swelling. It is something that does make patients high risk for cellulitis, right? Because with that condition comes dry, flaky, sometimes cracking skin. And so I wanted to share this, right? It's that purplish brown discoloration that you might see along the shin down to like the ankle. And if you're working in long-term care, guaranteed you have, you know, minimum of one on your haul, if not more, depending on how many hauls you have. So it's good for you to familiarize yourself with how those patients' legs, all of your patients, right? But those patients' legs look, right? Because they are high risk for cellulitis, so they may develop cellulitis. And for them, the symptoms you're looking for are pretty much the same. And you're looking for those same symptoms, right? You're looking for erythema, so redness, worsening in their swelling, pain, they could be weeping, and you might even notice like a little open area or cracking where, bacteria was able to enter and, infect them. And so then they do need antibiotics. Again, just sharing this because I find people get this, it can present for some people and look the same, right? Because some might even have a little bit of redness, but it's not, it's like a maroon, like a deep color versus the bright red and all of that. So I just wanted to share that and just encourage you to familiarize yourself with that, because that stasis dermatitis is something that you are going to definitely commonly see in long-term care when you're taking care of chronically ill. So